Welcome to our journey into building tomorrow's workforce. This is Unveiling Future Careers, the CTE Showcase webinar series, made possible through funding by the BACCC and presented by Workforce Innovation Labs, where education meets industry. WIL partners with colleges and regions across California to design, strengthen, and scale strategies that align learning with real-world careers. We're shining a spotlight on CTE excellence, best practices, and innovations ready for replication statewide. Every theme in this 6-part series is crafted to advance the Chancellor's 2030 Vision for Success. Today, in Webinar 2, we're tackling the seismic shifts rocking healthcare and emergency services, from workforce shortages to evolving training standards, and showcasing how California's community colleges are not just adapting, but leading the charge with scalable, equity-centered solutions. Together, we'll explore 3 breakthrough models that are transforming recruitment, training, and career pathways for the professionals our communities depend on. Good afternoon, everyone. Thank you for joining us today. I'm Mari Morris, the Project Manager for Workforce Innovation Labs and your facilitator today. On the call, we have Audrey Libador and Xavier Nazario, Managing Partners here at WIL, as well as Pat Aquino, our Project Management Assistant. She's working hard in the background, y'all. And today we have 3 exciting lightning presentations, and we will take questions after each short presentation. So please submit any questions you have in the Q&A. You can share your name, your college, and your question. We'll address as many as we can during those short Q&A segments after each short presentation, and then we'll try to answer as many questions as we can additionally in the Q&A chat. Lastly, please stay until the very end because we'll want you to complete a very brief post-webinar survey. As a reminder, the first 60 registrants who complete the post-webinar survey will receive the DoorDash gift card for participating. That survey is your ticket to that DoorDash lunch. I thank you in advance for your feedback because it really does help us continue to improve this webinar series. Okay, so personally, right, as an educator and a healthcare professional, I know firsthand how imperative it is to support the pipelines for healthcare and public services, especially here in California. There's such a great need and a demand for well-prepared first responders and healthcare professionals. And so I'm really glad that we get to shine a light on what's happening across our state to meet these demands in this sector of CTE. So to start us off, I'm really excited to introduce Tiffany Miller, Dean of Apprenticeship and Workforce Development at West Los Angeles College, where she's leading the Regional Allied Health Project. Tiffany brings 15 years of experience helping people launch and grow their careers through community colleges and nonprofits. She's also a recognized leader in apprenticeship, having registered more than 200 apprentices and managed a $12 million U.S. Department of Labor grant. All right, take it away, Tiffany.
Sorry, 1 second.
No worries. We need transition music or something maybe, huh?
Okay. Here we go. Okay, so as everyone said, I'm Tiffany Miller. I work at West Los Angeles College. We're one of the 9 colleges in the Los Angeles Community College District. And we're part of what's called the Los Angeles Regional Consortium. So I'll do a quick overview for those that don't know. The California legislature passed a bill to give community colleges strong workforce program funding. 60% goes locally to every college. 40% they've asked us to work regionally with the colleges in our region. So every community college is part of a consortium. There's 19 colleges in the Los Angeles area, and we make up the Los Angeles Regional Consortium. And so what the consortium does is decides how to set then that 40% that's given regionally. How can we work together and what should we spend it on? And so today I will talk about how the region chose health, an overview of our program, the keys to success, equity and student impact, possible innovation and replication, and our funding and sustainability. So the way that our region operates is any college can pitch a project in a way that we want to spend part of that 40% that comes to the region. So a lot of the projects are based in either one of two things. One is labor market information to show there's a high supply demand gap, meaning the demand is so high and the supply is not meeting the demand, or some sort of thing on the brink of becoming cool or big. And it's like, well, there's no LMI yet, but like we should invest in this now because it's going to be a thing very soon. So I think we all know health fits into the first category. There's a big demand, and we keep hearing, at least we do in LA, huge shortage of healthcare workers. Where are all the healthcare workers? We need more healthcare workers. And if you go to the doctor yourself, you've probably heard that. Sorry, we're so short staffed. Thank you for your patience. So that's kind of what we pitched at West. What is unique about the health project is normally a project will focus on a very specific thing, and all of the participating colleges will do the exact same thing. But that is not the case in the health project because there's 19 colleges in Los Angeles County. Every college is very different, and every demographic that we serve is different. So a health program that can work at one college won't work in another college. And as many of us know, as we're college professionals, a lot of our health programs have to be accredited by licensing boards. And so it's just not feasible that every college is going to have an RN program, or every college is going to have the capacity to create an LVN program, medical assistant. So it's really based on what the colleges think is possible, how looking at the supply demand gap in their local area, what can they do to contribute to a bigger supply. So that is what is unique about our project. And the only outcomes we're held accountable to are the California Legislature Strong Workforce Outcomes, which is more and better CTE in health. So we have to be enrolling more students and having more students complete our program, and then more completers get good wage jobs. So those are the things that bind our program together, but every college will operate autonomously and choose the programs that are best for them. I think it's important to mention colleges can spin their wheels and do whatever they want, but it really won't make a difference if you don't have strong industry partners, because at the end of the day, the students are doing these programs not just for, confidence building, but to actually get good jobs. So we have partnered with the Southern California Hospital Association, which is an industry association here in Southern California that hospitals subscribe to, and the Community Clinic Association of Los Angeles, which is a similar organization, but for community clinics. So I talked a little bit about this, but in looking at the LMI, so of course, the LMI shows us big picture supply demand gap, but how do we actually do those things and connect all the dots? Because as we all know, it's like, well, what's the problem? We have the program, students either aren't signing up, we can have more students, why aren't they coming? Or we are supplying good graduates, why are these employers telling us they're not able to hire anyone? We have a bunch of people waiting to be hired. So as we drill down, we had a couple of exploratory meetings with industry partners and industry associations, and talking about like, what's going on? We have the programs, we have the students, you have the workers, we could retrain them, what's going on? And so we really nailed it down to three things in our region that we could all focus on. One is clinical sites. It's kind of the cycle of the chicken or the eggs. The hospitals are saying we don't have enough workers, and we're saying we can't grow our programs without clinical sites. And then they're saying, well, we can't host any more interns. So we had that conversation a few times, because we're like, some of us are ready to expand. How can we expand the clinical sites? So through the help of the industry associations and in navigating relationships at different healthcare organizations, such as hospitals and clinics, we were able to strategically discuss what colleges were the most appropriate to expand clinical sites based on where these employers were located. The second thing was our partnership expansion. So we had employers at the table, but we really needed the hospital association and the community clinic association, because they had the networks. So where they already have the network, they could just do a blast out to hundreds of members in their institution. We have all these, medical assistants or nurses ready to go. Who's interested in taking a relationship to the next level? So they were able to expedite that process for us. And then of course, untapped students are current workers that want to upskill. And apprentices in the state of California can take community college classes tuition free. So that's a win-win because employers don't pay for it, students don't pay for it, and people get trained for free. And then the colleges get the enrollments. So that's what we focused on. It's made a big difference in equity and student impact. One is we have the employers at the table, so we really can tell students, this is really aligned with jobs, and they were working with us on our curriculum to make sure we met industry standards. But the important thing is in Los Angeles, almost every single of the 19 colleges are Hispanic serving institutions or minority serving institutions. And we predominantly serve underserved students. So just by expanding access to healthcare programs is student equity because we're giving more students an opportunity to get on the path to these good jobs. So as we expanded, we've also expanded serving underserved students. In some cases here in Los Angeles, we're being encouraged, we're now allowed to do instruction in other languages. So we could run a nursing program in Spanish, we can run a medical assistant program in Spanish. And so that's something we're starting to explore so we can have those communities that maybe don't have English language proficiency, they can take these in another language. And then of course, everyone knows about FAFSA. So students that qualify take classes for free and then they get paid with the Pell Grant. So that was often a barrier we saw. They're like, well, how can I afford a nursing program? Well, it's actually, you can go for free and we'll pay you. So we've been working on getting all that information out and it's made a big difference. And then of course, I already mentioned apprentices take classes for free. These are some of the biggest occupations that we focused on. This was again in combination of the labor market information and then also what our employers were telling us on the soft data, because you can only trust LMI so much because one employer searching for one job could post the job 20 times, but then an employer looking for 20 different positions may only post the job once. So we really needed to talk to the employers and being like, this is what we're seeing, what's actually your need. And so that helped us focus, kind of narrow down this big health sector into these jobs that you see here. This is a really quick snapshot. This spreadsheet actually goes for pages and pages, but I couldn't get it all on one slide. So what has been the impact of 17 of the 19 colleges working together? We've seen a 35% increase in certificates and degrees. So that's pretty big. We're pretty proud of that. And this is just for the certificates and degrees. This doesn't include programs, where students are just taking 2 or 3 classes and not worrying about the certificate or degree just because they need the specific skill set. So we're looking to improve this even more because the more graduates that we make, particularly in health, because it's all aligned to industry licenses, the less of the shortage that our employers are having. So we're working really strategically with them to be expanding the right programs and working with our licensing board to be like, okay, how can you help us expand? Because we have employers willing to do everything we need to hire them. So what's replicable? I mean, I wouldn't say there was anything that special about our region or what we did. We kind of just decided, hey, we all want the same things. We want students and California residents to get quality training at no cost or very little cost. And then we want to get good jobs. And we want our employers to locally source talent here and hire people in our communities. And once we had that conversation and didn't worry about you're stealing my students or I only want this employer for me, we were able to realize we're not actually in competition with each other because the supply demand gap is so big. We all couldn't meet it even if we had perfect enrollment and did everything exactly right. So we really just started talking to each other, put those other issues of worry aside, and just really had our hats on. What's good for me is what's good for you. And we wanted to work regionally because the more community college graduates that are hired and do well, that'll make employers want to hire more. And the word will get out, oh my God, these graduates are so good. So any community college graduates being hired is really good for our whole region. And so some of the tangible things we did, we had regional advisory boards, which helped with curriculum. Not everyone needs to ask the same employer to attend 17 different meetings in our region. We could just do regional medical assistant advisory boards and just have everyone come. Curriculum sharing, again, this curriculum is approved by a licensing board, so there was really no secrets to be worried about, just sharing course outlines of record, sharing some lessons plans, talking about best practices and lessons learned for some of our colleges that had been doing some of these programs longer, and then the colleges that were learning. Working with our community-based organizations that could either refer students or do their own training and be a partner in the pipeline. And then working with our workforce centers, some of us did put our programs on iTrain so that WIOA clients could be referred. And then also just working with them as they're working in the ecosystem of economic development, just being at the table and having those opportunities and knowing the right people to talk to. So it's really sustainable. I think you saw on our earlier slide that this project cost nearly $1 million for us to launch, but a lot of it is good because we really just needed to pay people, get some equipment, pay people to write some curriculum, but the clinical agreements are institutionalized. Most of us have 5-year agreements here, and so those are set and those cost no money. It was just a matter of getting the time and effort of the people at the table to really work those things through. These are now FTS generating programs. So the programs pay for themselves because now the enrollment is healthy and full. And we have a quality talent pipeline because everyone knows word of mouth is the best way to get the word out. So now the programs are really running themselves. And relationships, as everyone probably knows, you don't want to center it around one person because then if that person leaves, you're like, oh no, there goes that great relationship. So we've really worked really hard to make protocols and procedures to institutionalize what are the partnerships. So if this person leaves, how can the machine continue? And so some examples of that are knowing when employers, when is the hiring season for them? And I'll give an example. So for example, with pharmacy tech, our colleges typically operated fall, spring, graduates in June. But then we had CVS tell us, could you graduate them in August because our flu season is actually our biggest hiring season. So then we were able to, colleges that were starting, change the cohort so they could graduate students in either August or October. So then the graduates were ready to be hired right before flu season. And so those conversations have really helped us do these things that we maybe wouldn't have done before. And that's it.
Thank you so much, Tiffany. It was like so much interesting information, and I hopefully folks can take away some really important ideas on what they could implement in their regions and their colleges. I really like how, it's kind of an evolved idea in a way to be able to have kind of that flexibility within this project, but also like support with those guardrails to achieve the goals that they had set. And clearly, like you are making an impact by increasing enrollment and expanding the program. I'd be curious to know, because like we heard about all the like things that worked out, but like were there any challenges or things, learnings that you had that, had you run this program differently? Like there would be anything you would change? Just curious to know.
Um, our work is people, and so I think it's just a lot of ego management and a lot of it couldn't have gone any faster because you had to have the 10 meetings to get to the right conversation, and everyone has a fear of work. Just being honest, like there is a fear of working together. There was even a fear amongst our employers, like, well, I don't want to share this information with anyone. Like I don't want people to know. But once we realize it's like we all want the same thing, we're all on the same team. So you just have to be patient and just a lot of listening. It's a lot of listening and then just a lot of being open to new ideas and trying new things.
Yeah, I love that. But yeah, I would imagine you might have resistance amongst the colleges and programs for collaboration and sharing, even though it is to the benefit of everybody. But even, working in healthcare myself, I know things feel proprietary or, because we work in a HIPAA environment. So people feeling a little resistant to those changes or to collaborating, I get that. And this kind of falls into one of the questions we just got in the chat. But can you speak a little bit more on what the institutionalizing, sorry, industry partners looks like? Is it really just those like repeated conversations and listening, or what does that look like for you guys? How did you make that happen?
So a lot of it is doing some forecasting with our employers and understanding what were the relationships that were even possible to institutionalize. So what we found is some employers hire 20 medical assistants a year. That's what their average is. So we know every graduation cycle, we have our students apply to that job because that's typically how their hiring process works. And there's really no meetings or anything that happen now that we know that that requisition is going to be there. We just have to find it and then help our students apply. That's always an opportunity for them to apply. And so that was working with our career center, being like, okay, every April, can you do a resume workshop, for these students about to graduate? This is what the employer's looking for. Can you prepare them for an interview? And then these are the requisitions that we're looking for. And so that process is done. There's no more meetings because we know the hiring cycle of our employer partners. And then for the smaller employers that are like, I'll give an example, like the private practices, they're like, well, we only hire a medical assistant. I'm only using medical assistant as an example. We only hire them when our person retires or when somebody moves. So it's really one or two people every couple of years. Then we're like, well, why don't you become a clinical site? Because then you'll have an extern every year and then you have the opportunity to hire an extern. So it wasn't a one size fits all, but as much as we could, we wanted to take people out and be like, well, what's the actual process that happens? And then we just embedded that process into our program.
Great. And I think those are kind of some of the other questions we're getting in the chat. Maybe we'll have time for one more, but anything you can share regarding clinical placements, if they're increased, how were those conversations to be able to increase those clinical placements?
The conversations were really about, it was a little bit different. We have some larger employers here in LA, like Kaiser, Cedars-Sinai, and they had some pretty strict protocols and procedures. And so like those really weren't expanded at those bigger hospitals. It was really talking to some of the smaller hospitals and be like, hey, like you haven't had this program intern, but you have this program. And then really just explaining a lot of things they didn't know because again they're smaller and students aren't their focus, that like our instructors actually go out with them all the time, so they're never there unsupervised. They always have a clinical instructor there. And so like educating them on that process and then telling them what our minimum, exactly what we needed. Like we're like, well, we have an 8-to-1 ratio, so we really need clinical sites that can take 8, and just having those conversations. And we had to have the same conversation over and over again until we found those employers that were willing to be like, okay, I really want this because I want to hire the intern. So it wasn't like they were doing us a favor. They were getting something out of it because they're like, I see the internship as, an 8-week interview or, a 1,000-hour interview, depending on, the program. And so like they're investing in their ROI, that they'll have to do less work on the hiring side because the interns are going to be at their hospital. And then there was also some like reviewing what their minimum qualifications were. Because for some programs, we found they would accept interns, but then they would only hire people that had 2 years of experience. So we're like, okay, you're taking them, you love them, you want to hire them, but you're sending them away. You said, come back in 2 years when you have 2 years of experience. So exploring what are those minimum qualifications and where are there room to wiggle so it could be a win-win, because it can't just be you're doing the college a favor, you're letting us train more people if you take more, clinical interns. It has to be, how are we helping you and how can clinical interns be part of that solution for you? And once we did that, it got a little bit better.
Yeah, I think that's an important point to make, that it's like they're not doing the college a favor, right? We're doing them a favor. And how do we position ourselves for them to see it that way and maybe change the story that they've been telling themselves about it to really shift their relationship? That's awesome. We still have some other questions in the actual chat box, but I'll just encourage all of our attendees to utilize the Q&A. It'll make it easier for our presenters to answer those questions in the Q&A section. I know, Nanette, you had a question that was similar to the other ones, but I want to make sure you get it answered. So I just let you know, Tiffany, if you want to answer hers in the chat. But in the interest of time and making sure we keep to our schedule, we're going to move on. But thank you so much, Tiffany, and for all your insights. And hopefully we can continue the conversation going. We will share contact info for our presenters as well in the post webinar, because we can continue to collaborate across the state and not just even in the regions. So thank you so much. Thank you, Tiffany. Next up, I am happy to introduce Phil Rawlings, Dean of Instruction, School of Public Safety at Moreno Valley College. With decades of experience in public safety and education, Phil, together with his dedicated colleagues, has built a paramedic program that's now a regional model, inspiring and encouraging other colleges to launch their own to meet the growing demand for skilled first responders. Welcome, Phil.
Thank you, Mari. Thank you very much. So basically, I'm a lot of this topic that I was going to bring up is very similar to what Tiffany's already talked about, but it pertains more around the EMS side of thing, EMS services, emergency medical technician, and primarily the paramedic, because as if you look at the LMI data, the paramedic demographic is really, really needed at this time in the state of California. When I spoke with CalFire's EMS deputy chief, Jared Andrade, he was estimating just for CalFire and their contracts, and they contract with 21 counties in the state of California. They were 570 paramedics short, anticipated for the next. So it's going to take a while for the next couple of years to get out of that hole. But just in Riverside County alone, there's quite a few missing paramedics at this time. And that's why this collaboration was established. And it was established between members of our consortium, which we are part of the Inland Empire Desert Region Consortium. It's 11 community colleges in the San Bernardino, Riverside County area. And we're primarily focused on partnering with Riverside County colleges, Mount San Jacinto and College of the Desert. And the reason we collaborated is because the county fire chief brought forward his concerns of needing at least 100 paramedics per year. And that trend has been trending since around 2010, where no less than 82 paramedics were hired between 2010 per year, no less than 82, and up to about 120, at least when I was there. I was the EMS bureau chief from 2010 through 2018. So there's a huge need. And why is that need? Why do we need to collaborate? And why did we bring this forward? Is to improve the number of students that are coming out of our paramedic programs, but also the importance of focusing on the regional protocols that exist within the area. All the paramedic programs throughout the country all work towards the standard of National Registry and training to that standard. But our industry here in Riverside County is really requiring us to also focus on the specific protocols that they are going to be employing in this particular area in Riverside County. To give you an idea, Riverside County is not nearly as big as LA County. I'm just teasing. We are considerably larger. We don't have as many people as LA County. We're 7,400 square miles. The next biggest county to us is San Bernardino County at 22,000 square miles. So we're 7,400 square miles. We have 2.75 million people, not nearly as many as LA County, but we do have a needs for a regional type philosophy on training and educating paramedics in the area because we are a big county. So COD has tackled the east part of the county, and we're continuing to tackle the west part of county. And we're doing 2 paramedic cohorts a year here at Moreno Valley College, with approximately 60 students targeted for that. And currently, the COD is working on. They're at 16 right now. They started with 19, but they're at 16. They were slated to graduate their first class in May of 2026. But we wanted to work together with the deans at the 2 colleges, so 3 colleges total, to utilize a standardized curriculum. And what we did is we standardized based off of our already established course outline and record. And then we worked with our faculty, and our faculties were kind enough to share much of their curriculum so that we can standardize it across the county. And that helps for a couple reasons. Again, for National Registry testing, but also for Riverside County testing to become locally accredited. So, and we also leveraged strong workforce funds as it related to the region, where we standardized a lot of our equipment where we could, and equipment was purchased using strong workforce funds for both COD and Mount San Jacinto, in an effort to be able to expand and meet the needs of the county. Hold on, I apologize, my screen's not moving forward. Whoops. So let me make sure. So one of the other things that we've been collaborating between the 2 other colleges within the region is the ability to hire a hospital liaison coordinator, much like what Tiffany already explained about with clinical rotations. Those can be a problem when you have multiple colleges competing for not only hospital clinical rotations, but field clinical rotations. And we are in the process of trying to work out the details of using through the regional consortium the funds to hire a hospital liaison coordinator that in essence would be an air traffic controller to help coordinate all the efforts that happen at all the different hospitals that we have. We have 8 hospitals that we potentially would be sharing. Now, College of the Desert mostly has hospitals that are in the Coachella Valley area that they would be primarily utilizing, and we mostly have our hospitals on the west side of the west and southwest of the county, and we'd be coordinating and using them. But for the most part, you still have the potential for competing interests in regards to clinical locations, particularly in the OR setting when we're trying to get live innovations for our paramedics when they're in their clinical time. We want to get this position hired and start testing it out and making sure it works as intended, where there's a collaboration between the hospital coordinators at both institutions. Or all 3 institutions. And then that hopefully will evolve into a field internship coordinator type situation where we can also utilize that in a manner to control not necessarily control, but coordinate the efforts of field internship, because the minimum hour requirements, 480 hours minimum, it can be a daunting task when you have a limited amount of interns that are eligible to be an intern as per county protocol and or state guidelines. But one of the other things that we've been working with is creating or minimizing the financial barriers that exist with our paramedic training program. Our paramedic program is relatively affordable at $5,800 per student, and we've partnered with Riverside County Workforce Development. And workforce development is basically doing sponsored learning for them, and they are through the application process, they are utilizing Workforce Initiative Opportunity Act funding so that those that are eligible are getting their paramedic training fully funded. We are focusing primarily this year on only the paramedic program. We were focused on the firefighter academies that we do here and the paramedics, but due to some cuts, and we've decided collectively that the higher importance for getting people out there is on the paramedic side of things. And these courses or our courses are entered into the EPTL system, and the county does all the screening process and does a voucher system with the college so that the students are not incurred any additional expenditures. So what we're hoping for, and I've already alluded to this, is we're running 2 paramedic classes per year. We're hoping for an impact to the county and meeting the need of the county fire chief, not only him, but the other municipal fire departments that operate paramedics and AMR, because what happens in our system is AMR gets depleted because many of the paramedics want to progress into a firefighter paramedic position, and that becomes a drawdown on the resources for AMR. AMR as a transport agency, we need to ensure their success and ensure that they have the needs of the county met as well. So it's kind of a twofold situation. COD is in their first paramedic cohort. Should graduate around May 26. And I want to emphasize that this is just in its early phases, and we're really don't know the exact successes yet, but we are hoping that we'll glean a lot of success out of this. And I'd like to mention that I think the reason paramedic training needs to reside at a community college is because of the quality and the scrutiny that a community college is under for accreditation practices and standards. And I think it makes for a higher quality. I know this because I hired them. And I know that community colleges do a great job at training paramedics. The last thing I'll mention is that right now the paramedic cohort at COD is being run through their PACE program. It's being funded through their PACE program and part of their nursing program. And it is currently, because they did not have the curriculum in place, they're doing a non-credit class at this time, following our curriculum. So as such, if the curriculum is not in place by the time these students graduate, we will be offering CPL for those students since we know that the curriculums were matched up. And if not, and COD has it in place and they want to offer the same thing to their students, they certainly can. But I really want to advocate for the use of CPL, credit for prior learning, for institutions that have trained paramedics that were non-credit programs, that paramedics that are incumbent working in the field have an option to come into the community college system.
Thank you so much, Phil. That was really insightful, and I just love that. I think CPL is really top of mind for colleges as they're trying to implement that more, and a really good way to kind of create that full circle where you are, a place where people can come back to and get professional development as well. If you're going to give them credit for prior learning, to give them a certificate or degree that maybe they weren't in before, now that it's available. So I love that. We only have one question in the chat right now. Feel free, attendees, if you'd like to ask some questions, use the Q&A box for that. But Bill's asking, other than the Cal JAC apprenticeship program and instructional service agreements, is anyone aware of the California Community College or a community college offering firefighting apprenticeship programs?
Yeah, CalJac kind of holds the market on that right now. I think if you're going to look at that endeavor, I would look at fire departments that are non-affiliated with CalJac, because then you wouldn't be in a competing interest with them, and or look at a pre-apprenticeship. I don't think CalJac has any pre-apprenticeship endeavors, but let's talk about that a little bit. It's firefighter. It doesn't say paramedic. It says firefighter. So we have entered into an agreement, Learn While You Earn program with AMR, and we have a signed contract with them, and we hopefully we'll be tracking a lot of our EMTs into their programming through the VST system, and subsequently working in the field as an EMT, and on into our paramedic program. And I think that's a good partnership to have, and I think that's something that's eligible in many many counties of our state, because AMR does exist. It's very large, and they're a good partner to have, a great partner to have. I don't know if that answers it completely, but I could go on and on about some of those kinds of things.
Yeah, and hopefully we can continue that conversation going now that folks know that you're a resource. We'll be sharing your information. Thank you so much, Phil. And actually, our next presenter might be able to speak a little bit to firefighter internships as well. And so I'm delighted to introduce Calogero Monachino, coordinator and lead instructor for the Mission College Firefighter 1 Academy. With a career that began in England and over 2 decades with the Santa Clara City Fire Department, he brings deep expertise and a real passion for mentoring. The academy he leads maintains a near perfect pass rate while fully complying with the CAL FIRE and state regulations. Welcome, Cal.
Okay, good afternoon, everybody. Welcome. Thank you for the opportunity to present today. I'm Cal Monachino, Academy Coordinator and Lead Instructor here at Mission College Fire Academy. I'm going to share a PowerPoint with you. Okay, there it is. That's excellent. Okay, slideshow. Okay, great. Now, Mission College Fire Academy. So just to give you a very brief background, what do we do here? Who are we? What are we about? So we're under the School of Public Safety, Health and Wellness. And under that is the Fire Protection Technology Division, of which I'm a part. Within that division, we have the EMT program, of which we've just added another cohort. And that speaks to Mr. Rawlings's concerns about, the lack of EMS providers. We're feeling that too. It's statewide. We have a fire academy, which I'm in charge of. We have an AS degree in fire protection technology, which we've had for some time here at Mission College. And in the future, in the very near future, we're looking at implementing an emergency communication dispatchers program, because just like EMS, there is a need for that. And specifically in our local community, there's been a problem with retention of emergency communication dispatchers. And we believe that a lot of that has to do with training. And then in 2017, we are going to launch our BA degree in Emergency Services Administration, which will cater to public safety administration for fire, police, and EMS. So that's just a big overall view of our School of Public Safety, Health and Wellness. What do we do at Mission College Fire Academy specifically, and how do we tie into that? Well, I'm very proud of our students in that 100% Academy success rate. We are in our 7th Academy right now. We do 2 cohorts a year, one in the spring, one in the fall, each with 25 students. 100% have passed our academy and have received a course completion certificate. Also, 96 to 100% right now have successfully passed California State Firefighter 1 certification without any retakes. What does this lead to? CalFire requires the State Firefighter 1 certification. Once that's coupled with EMT or basic first aid, every graduate is eligible to work for CalFire. And CalFire, as you know, provides firefighting opportunities up and down the state. They don't need to stay in this immediate area if they don't want to. Also, local fire protection agencies, such as the one from which I come, Santa Clara City Fire Department, hires with or without Firefighter 1. Now, paramedic, EMT, ambulance providers are other options that our students can take. Having had EMT, knowing that there is a need for paramedics just as strongly in the fire service as there is for the private ambulance providers, some of them may choose to get some experience with an ambulance provider as either an EMT or a paramedic prior to pursuing a fire career. So there are different options available to them. And like I put in the comments, we also have a fire prevention internship program here at Mission College as well. And we did have one student who came and took a Firefighter 1 class just as a survey course, just to see what it was about. And in there, he found his desire to do fire prevention and then later pursued that field. So we were able to help him out with an internship. So there are different avenues that students can pursue. Our goals and how do we do it? Well, obviously, we're here to deliver the Firefighter 1 curriculum as adopted by the California State Fire Marshal and be compliant at all times, which we are. But what we're trying to do as well is we're working on the notion of what this is all about, right? Education meeting industry. That's where the gap needs to be bridged, okay? And it needs to be bridged to have equitable outcomes, which is what we do. So we prepare them also for the moral, mental, and ethical challenges associated with the fire service. In other words, we're teaching them about the culture. And as we know, in order to have a culture, your culture starts with attitude. Going in with an attitude, that then dictates your behavior, and then that will show what your attitude is. We reverse engineer that. We show them what the culture is that they're going into, and we prepare them for that by instilling the correct attitude into them. We teach them about being critical thinkers and problem solvers, and to work as a team in the fire service. Eventually, we want them to be not just leaders in the fire service, but leaders in industry, and that will then make full circle back to their communities where they came from, and they will then also be leaders in their communities as well. So what do we do here? Our mission is simple, right? We serve the community right here in Santa Clara by inspiring and developing our future firefighters and EMTs, and we do that with instilling the values of commitment, honesty, and integrity. On their patch, you'll see professional, proud, progressive. Those are values that we have them live by in preparation of their careers. So we model our academy based on a regular fire academy. Many of our students and many people who come into the fire service for the first time have no idea of the code of conduct, the culture, the behavior, the accepted norms, how it is in a fire academy. And that can be daunting. That's been barriers for people in the past. Whereas if they just had a little insight first, they would have been successful. We provide that insight here. And then in return, they're also expected to maintain a level of professionalism that's commensurate with the workplace. We instill that in them early on. The day-to-day operations are physically demanding, as they are in the fire service, and we expect them to be professional at all times and have the same level of professionalism from our instructors. How do we run the academy? As I've said, we have two cohorts, one in the spring, one in the fall. They both run from Monday to Thursday, from 9:45 to 17:45. So that's 7.5 hours of instruction per day. And on Tuesday and Thursday, they come in early and they get involved in a kinesiology class, which is a physical training class aimed at them being able to complete the physical agility requirements when they go to take a fire test. We have a progressive discipline model too. We introduce that just because we want to instill them early on. They're going into the workplace. We're getting their attitude adjusted right now for that. Yes, they're in a school, but we're working with the end in mind. We know where they're going to end up, and we're getting them ready for that as early as possible. We have a discipline flow. We have memos. We have calls for discipline. We write them up, but we don't do it from a punitive perspective. We do it from a way of modifying their behavior to set them up for success later on. That's why we do that. Big thing we teach our students from day one is there is no such thing as luck. If they want to secure a job as a firefighter, which is very competitive, There is no such thing as luck. Two things need to align in order for them to be successful. Those two things are opportunity and preparation. Opportunity, a job is announced, sure, that's an opportunity. We make them aware of that opportunity. And as people in industry, in the fire service, it's also our job to remove barriers as well, to expand that opportunity to everybody. And as far as preparation, we teach them the skills that they need to know, but we are also very, very heavy on mentoring as well. And teaching them exactly what they need to know about the culture, and teach them all the things that come from our experience that you don't get out of a textbook, that are not included within the state curriculum. Those things are equally important. It's great to learn the skills and be able to do things, but you still have to secure the job at the end of the day. And it takes just more than being able to do the skills. So teaching and mentorship in equal parts. That's how we're able to be successful. The next steps. So what's next? So as I said in the beginning, we're looking at doing a 4-year degree here, and we're looking at a dispatcher program. So to focus on the 4-year degree briefly, why are we doing that? Our model is going to be such that the upper division classes are going to be available online. If a student comes in with an AS degree from any California community college, we are working toward making it so that they can transfer everything they have, and all they have to do are take the upper division classes here online, and they will have a bachelor's degree. I'm currently working on the committee to establish that bachelor's degree program. What does that mean for a student that wants to be a firefighter? Well, now they have the option of perhaps they want to, after the academy, finish their AS degree, go on to do a bachelor's, or do they want to get a job in a fire service and then a couple of years later come back to Mission College, get a bachelor's degree? Why do they need to do that? As they progress through the ranks in the fire department, bachelor's degrees are becoming more and more required. The skills that they learn, especially business degrees, something like this, public administration, are invaluable. The responsibilities that the students will take on once they move beyond the rank of firefighter, beyond the rank of captain, up to battalion chief and above, they're going to be dealing with budgets, they're going to be dealing with policy, they're going to be dealing with HR, they're going to be dealing with a lot of other things that have nothing to do with hoses and ladders. And so this prepares them for that. That's our next step. We've added an EMT section, and we're about to add another one. We're looking at doing an advanced EMT program. Our ultimate goal is to do a paramedic program here. So Dean Rawlings, I might be reaching out to you later to get your advice on how to do that so I can pass it on to our people. So yeah, essentially our education is meeting industry, and we're doing it with equity in mind. Thank you for your attention. So our second cohort, let me not forget about that. So I talked about our hours. Okay, so we're talking 9:45 to 17:45, Monday to Thursday. Not everybody can do that. So we're going to start looking at doing a blended course in which the didactic, the cognitive, or the book work is done online at the student's convenience. And then certain days a week, probably the weekends, is when they come and do their skills, followed up by about a month of state testing for them to get their certs. That way we will reach a greater audience, specifically those who are not able to, for work reasons, for family reasons, be able to attend during the week. And one-stop shop simply means that they can come in, do their introduction to fire classes, EMT, paramedic, 2-year degree, 4-year degree, Firefighter 1 Academy, all right here at Mission College. That's all I've got. If you have any questions.
Thank you so much, Cal. I don't have any questions yet in the Q&A if anyone wants to add some, but we'll also be sharing our presenters' contact info in the post-webinar. So I hope, like I said before, we continue this conversation. It sounds like Phil and Cal are going to be connecting on some collaboration here with the knowledge. I love that. That's what this is all about. And actually, I wanted to take a minute to kind of share a little bit about this project in general. So here at Workforce Innovation Labs, we were tasked with project management for the BACCC. The BACCC has funded this project for us to be able to really shine a spotlight on best practices around California and in CTE. And so that's kind of where this all came from and where this webinar series was born. So thank you, BACCC, for making this possible. I also want to share a little bit about WIL because you may be new to us, but here at Workforce Innovation Labs, we're a project management firm that I mentioned before, but we really help great initiatives achieve their vision We've already partnered with over 30 California community colleges and counting. And I say this all the time, but having been like on both sides of it now, because I'm also a community college educator and have managed and coordinated programs that are grant funded, it's such a catch-22. You need bandwidth to build bandwidth and to align industry with your courses and programs. So whether you've secured funding or still navigating that process, we're really well-versed in filling that early stage capacity gap and building teams, launching programs, and connecting the dots between industry, education, and community. So that may look like a different combination of project management skills, essentially whatever it takes for the project to move from idea to impact. And I like to think that we do it with a lot of fun and creativity too. That's why I really enjoy my work here at WIL. So if you have a project or need a partner in moving it forward, please connect with us. Here you can find our contact information. Please give us an email, reach out to me, connect on LinkedIn. I would love to stay connected. And if you want to learn more about the special work that we do, you can see our website at workforce-innovate.com, or you can even follow our YouTube channel, because we will be posting these webinars on there as well. You can catch our last one as well. But I want to give a huge round of applause to our presenters. Thank you so much, Dean Tiffany Miller and Dean Phil Rawlings and Battalion Chief Calogero Monachino, for sharing your expertise and your inspiring insights and new ideas. Hopefully this spurs more innovation across the state in the sector of health and public service and CTE. So to everyone joining us on the webinar today, we'll be sure to share the recording and the contact information in the follow-up email to help keep this conversation going. But as we near our time together, don't go. I have one favor, one quick ask. Please fill out our post-webinar survey. It's now going to be linked in the chat. Thank you, Pat. And think of it as your exit ticket out of here for today's session. So by completing it, you'll be among the first to get info on our next webinar and the registration link for that. And as you can see, we've got some really great topics coming up in this webinar series. So if you're one of the first 60 registrants to complete it, you'll qualify for that DoorDash gift card if you complete the survey at the end, like today. So definitely add these webinars to your calendar. And if you happen to miss our last webinar, don't worry, you can catch the recordings on YouTube. I know there were some questions of folks that had colleagues that wanted to attend it and couldn't make it. That's all right. You'll be able to view it at our YouTube channel at Workforce Innovation Labs. I know we still have a few questions in the chat that came in a little bit later. So to our presenters, if you're able to answer some of them, that would be great. If not, we'll definitely share them after this webinar, but I definitely would love to hear your feedback, everyone. So please make sure you fill out that post-webinar survey that's in the chat. But thank you, everyone. And we're really grateful for your time and your feedback. I appreciate you sharing your lunchtime with us. And we hope this webinar really offered some meaningful takeaways, that we made the most of your time and you can bring some of these learnings back to your campus, your region, to help serve as the beginning of this conversation. And we look forward to seeing you at our next webinar. Thank you so much, everyone, and gave you a little extra minutes back to be able to make it to probably your next Zoom meeting. Thanks, everyone. Thanks for joining.